It's a bird.
It's a plane!
It's the Glute Guys. Hello, everybody. Welcome to the Glute Guys Network. I'm Dr. Aaron. We're on Spotify and on YouTube.
And I'm Dr. Tom. We're back again to bring you some health news and give our insights as physical therapists.
Today, we're looking into Gabe Davis and Clayton Kershaw. They both had left meniscus repairs.
Not fun. Not good for the guys. I mean, the nice part is for Clayton Kershaw, he's got a little bit of time, baseball player. You know, season's now out past the World Series. Gabe Davis, on the other hand, he's in the middle of his NFL season, so not a good look for him right now, but let's we'll dive into it a little bit deeper. So both left knee meniscal repairs.
Yep. And Davis, I believe, is out for the season. Yep, out for the season with this meniscus repair. And it makes sense. I mean, it's something that's going to take a long time.
Yeah. And, you know, the meniscus is one of those tricky structures inside of our body. It's purely cartilage. To go over for the meniscus, we're going to put a picture of it right here so you can see. But the meniscus acts as a stabilizer for the knee joint. It's like they're essentially two little cups that sit inside the knee. They help stabilize it. They work alongside the cruciate ligaments, ACL, PCL, and they act as like shock absorbers inside of the knee as well. Without it, you start to have a lot of pain. Now, the tricky part about it is it's not so well. It doesn't have a lot of blood flow. Yes, thank you. It's not so well perfused. So
yeah, so a lot of blood flow. Perfusion is just the amount of blood flow that goes to a certain amount or to a certain area.
Yeah.
So with the meniscus, like you were saying, the outside has good blood flow. The middle is like 50-50, and then the inside's like nothing.
Exactly. And the outside, we call it the red zone. It has the most blood flow that goes to it, and there's white zones as well, and that's areas that don't have as much blood flow.
And then when we have one of these injuries, a lot of the recovery depends on how much of those zones is torn or what the issue actually is. Like if there's a tear and it's only in the red zone, it actually tends to do a little bit better than if it cuts all the way through.
Of course.
Makes sense.
Yeah, you know, you think about blood flow, it's bringing nutrients and appropriate healing factors to the area to allow that to heal appropriately. When you have a white zone, you're not getting as much blood flow. Sometimes you're not really getting any blood flow to the area. So it takes much longer for the body to heal it. And in some cases, they just don't heal the way that they're supposed to, or they don't heal at all.
Yeah. So, well, a lot of times when you have one of these injuries, you actually end up injuring your ACL too. Thankfully, it doesn't seem like either of these guys injured their ACL too.
No, I do know that Clayton Kershaw also had a left toe injury, but I believe that was unrelated to it.
Yeah.
That's the only other injury that they have for these two on the board.
It is interesting. Like, was he just playing the entire World Series with this problem the whole time?
No, because, he could have been. He might have been pushing through it.
I mean, you can change your windup as a pitcher a little bit. Windup is just like the steps you take before you throw the ball as a pitcher in baseball. Yeah. So it's possible that he altered it a little bit instead of doing the full routine, just like cutting it in half.
Of course.
Honestly, I didn't watch the World Series enough to know.
I'm not a big baseball guy. I do follow it loosely, but I know who Clayton Kershaw is, but I don't know enough of his mechanics to be able to analyze and watch if he's changed anything.
Yeah, we do know that baseball has a lot of twisting, a lot of dynamic movements that it makes sense, especially when you're a pitcher. We'll put a quick picture up of like in your stance about to throw.
Yeah.
And there's going to be a lot of twists. There's going to be a lot of forces on your knees, on your hips, on your whole body.
On both legs too. You know, it's just like you have your plant foot and you have your stance foot. So it's just both of them are going to be twisting and turning and whatnot. Same thing with like golfers. You know, you see like the foot and the ankle and the knee roll all together when you're swinging. So it's a lot of twisting motion for baseball.
I think the only difference is like golf is a lot of twisting, but it's a little bit more static, at least with your feet.
A little bit.
Or, I mean, you're going to rotate a little bit, but your feet, I mean, they are rotating.
You kind of roll that ankle a little bit.
Yeah, you sort of twist it around as you move your hips.
But for baseball, doing that kind of a wind-up, you know, it's a lot of pressure at the knee, especially when you're in a single-leg stance. And for pitchers, when you're following through, you're going from one single-leg stance onto another single-leg stance. So it's not the most, per se, stable time. So adding a little rotation, wear and tear on that meniscus, you can pop it.
Yep. And then looking a little bit more into Gabe Davis. I said Gabe Douglas before. I apologize, Gabe.
I didn't even notice this time.
No, not in the beginning. But like we practiced a few times, and I just kept saying Douglas. But Gabe Davis is a wide receiver in football. So a wide receiver has to run routes. Like if they're going out for a pass, they have to do certain quick movements to try to get away from the defender.
Yes.
And that's a lot of twisting. Like it makes sense, unfortunately, that he's someone that could have done it.
Yep.
Like you probably aren't going to see it as much with a lineman who doesn't have to do like such really like a twist like that.
Shifty motions, it's that like sudden plant and turn. Which I mean, thankfully, like you said before, it doesn't seem like he tore either the ACL or the MCL with it. Very commonly, those three go together.
As far as we could tell. I mean, we don't always get the full story with all this.
No, they might have found a minor tear or something there. You never know. They always end up doing a little bit more.
Mm-hmm.
But most common way to tear all three at once is a very common wide receiver moves, planted foot, and a twist. All of a sudden, when they just go and they twist that leg, you put a lot of pressure on the meniscus, you're putting a lot of tension on the ACL, and you're putting a lot of tension along that MCL too.
Mm-hmm.
Very common to pop all through.
Yeah, and if you think about it, like if you tear your meniscus, something that deals with all the shock absorption, it's like a secondary, I guess, stabilizer for your knee. Like you can't play a sport if you don't have stabilization in your knee. A lot of times that's actually one of the symptoms. Your joint is like very unstable. Of course, it's painful. It could feel like it's giving away too. You can't play something like football or baseball or really any sport if something's given away.
Yeah, that like cup kind of structure that it gives to the knee gives the joint a lot more congruency. So if you end up tearing the cup, the joint's not going to be as congruent. It's going to be a little bit shiftier. You end up leaving more room for error during those biomechanical motions in the sport.
So basically what Dr. Tom's talking about is if this is like basically your joint or your femur is like this. So it's two little sort of ball type things. And then your tibia is more flat.
Like a plane.
Yeah, more flat. So if you have sort of round things going into something flat, it's not going to go well. It's just going to make a lot of wear and tear. So the meniscus is sort of like this. There's those cups that the femur sits in. We'll put another picture up if we haven't already put like 10 up in this video.
Yeah, more pictures. We'll put a picture of Aaron right over here.
Yeah. You could put me just like this.
Yeah, right from his wedding. We'll put him and his wife right in there. Just a quick look for a second.
But yeah, just being said, all that shows how important the meniscus is. It does so much to support your knee.
Yeah.
But going into a little bit about what we do post-op, what we do pre-op. Most of the time there isn't pre-op because it's acute.
It's painful too. I've gotten a couple of pre-ops, especially when it starts to, you run into the issue where like insurance wants them to do physical therapy first and then we'll do MRI. So you have to just be very gentle at the pre-op. I mean, are you going to tear the meniscus more? Not as likely. So you just kind of start with just some easy, light strengthening exercises.
Get the legs stronger.
Yeah.
Get the quads stronger. That's a big one with like knee replacements and similar things.
We do prehab, which is just strengthen it up in a
pretty much a strength in everything.
Yeah. It's in strength, we don't mean like, if we're gonna throw a barbell on and get them squat and whatnot. Just build up the muscles that you as much as you can in a comfortable setting and go from there.
Yeah, and that's something that like you shouldn't just go willy-nilly and do whatever you think is the best. Like it's good to have someone that knows what they're doing to make sure you don't hurt yourself further, because you can definitely hurt yourself further.
Yeah. Oh yeah.
You need to have maybe a slow progression, maybe start off easier and then see what you can do from there instead of jumping into 400-pound squats and making things worse.
Oh yeah.
Then you have your surgery, do a few things. And based on
you had to do crutches and stuff like that after your surgery.
Yeah, so the first few or maybe a week or two, you have to use crutches most likely.
Yeah, it's very slow loading back on the meniscus because those sutures have to heal.
Yeah,
if you put too much pressure on it, you can pop the suture, and you just don't want to go and ruin what the nice surgeon did.
Yeah, so similar to other recoveries, it starts off with maybe you have to use an assistive device, maybe you have to use something to help.
Mm-hmm.
You gradually build strength, build range of motion, try to mitigate pain as much as you can.
Yep.
Then you get more into the mid phase where you're starting to do more normal tasks, your activities of daily living. So getting ready in the morning, going up the stairs, walking, hopefully you could drive, walking to your car, seeing how that's going.
Well, for these guys, they can. It's their left leg.
That's true. Yeah, they're both left leggers.
They're allowed to drive.
And stuff we didn't even bring up for these two is it's going to definitely be different for both of them. They're not going to have the same process because everyone's different. Everyone's going to have little things that are a little bit different.
Pain tolerance is the biggest one for a meniscus. You get a lot of swelling that's inside of there, the pressure. Some people can tolerate it. Some people can't.
Mm-hmm.
A lot of it's inflammation control. And then a lot of it is going to be just kind of slowly building up the weight bearing through the knee.
Yeah.
what they can tolerate, and that's going to look different for both of them. I've had some people where they can all of a sudden they get clearance from the doctor to be weight bearing or tolerated, and they can just step on it right away. I've had other people where it's screaming bloody murder, and I got to just work it way up like super slow for them.
Yeah, and with someone like that, it could be as simple as trying to shift weight onto your leg and get used to putting weight on your leg. Someone that feels good, it could be a little bit easier. Like you just work on walking and their mechanics when you're walking.
Exactly. A lot of it also has to deal with like the fear avoidance that we've talked about. That's healing is also a big mental state, and if you're not in the right mental state and mindset for it, you can see some different symptoms pop up as well.
Yeah, fear tends to lead to other issues. So it's best with these things to, although it's going to probably be painful at times, to stay optimistic. Like it's going to get better. You just have to keep being consistent.
Exactly. You got to get past that. The beginning is always the hardest part. And the more and more that you do, the better it gets.
I mean, I've probably said it before, but it's never like straight better. It's always like up and down and up and down, and then it gradually gets better. It's all going in the right direction.
My favorite spiel that I tell 99% of my patients is that physical therapy is like the stock market. It's just like I was able to use that at first when I started, and then when the stock market started to crash a little bit during COVID, and when it started going down, I was like, probably can't use that anymore for a moment. But the stock market's back up, so it's good. But yeah, you have ups and downs, and you just want to keep seeing it trend in that positive day. But not every day is going to be a good day. Not every day is going to be a bad day.
I do this like all the time.
Yeah, just some of my patients are like that, and some of my patients are like bang, 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 and you're like, everybody's different.
I mean, I think those are most of the things we would talk about. Actually, going a little bit deeper into it, after you get past the walking, the ADLs, that stuff, then you start to get more into sports.
Yes, and for these guys, they're going to have a very long, a much longer phase 3, especially since they're going to be out for season, mostly for Gabe Davis Douglas.
Gabe Davis.
Yeah.
I know.
I'm just making sure, double checking. He's going to be out for season, so he's going to have a really long phase 3, which is just phase 3 is that sport specific training.
Yeah, I mean, part of it for Gabe is that they're already in the 10th or 11th week, so they only have like 6 weeks left. So,
and let's be honest here. Sorry, Jaguars fans, they're not going anywhere. I'm a Jet fan. I'm allowed to say these things. I'm more sad than they are.
Yeah. We have nothing good to say about that. I'm a Broncos fan. Bo Nix.
Yeah, you know what? We just fired everybody. It was great. I welcomed my girlfriend into the being a Jet fan. It's like this is what it is.
I don't think Robert Saleh is that bad of a coach. I think there are other factors.
Not that bad of a defensive coordinator. He wasn't really the greatest head coach. I loved the hiring.
They did good last year, right? What was his record last year? What was the record?
I'll put the record right there. It was no good.
Well, it's not that bad. It's the Jets. What do you expect?
Exactly. I think we had one more win than we have right now, maybe.
Really?
Yeah. I can't remember off the top of my head because I try to block some of that stuff out.
We have to find it. A little pause in the middle. Oh.
No, we went 7-10. All right, so we weren't god awful.
Oh yeah, I mean compared to now.
Yeah,
that's a great coach if you ask me.
Not once did he ever get above 500. Is all I'm going to say.
Well, with that, I think that's everything we wanted to talk about.
Yeah, you know what? We just wish these guys a quick, speedy recovery, getting back safe and healthy, and hopefully a good season in the future for them.
Yeah, go through your rehab, take your time, don't rush back into it, especially with this pain stuff. You don't want it to flare up. You don't want to make things worse.
No.
It's always better to take your time, especially when you have your career ahead of you.
Of course. Can you just one last time please apologize to Gabe?
I'm sorry, Gabe.
Perfect.
I probably shouldn't have just not mentioned it, all the Douglases I called you, but Gabe Davis, sorry.
And that's everything.
Thank you.
Honestly, the Gabe Douglas kind of added to it. It was kind of just a funny thing that we could just kind of banter off of.